stroke. Dr. Mohammed Ashraf, Assistant Professor Medicine, College of Medicine, Majma University. Objectives: define stroke and TIA, transient ischemic attack. Enumerate types of stroke. Discuss localization signs. Describe mechanism of stroke. Enlist the risk factor of stroke. Identify the causes of stroke. Definition of stroke. Rapidly developed clinical sign of focal disturbance of cerebral function of presumed vascular origin and of more than 24 hours. WHO. TIA, transient ischemic attack, recovery is complete within 24 hours. 10% of patients will go on to have a stroke. Stroke is the third largest killer in the Western world. It accounts for up to 6% of inpatient hospital costs in Scotland. Stroke is one of the major causes of disability, particularly in the elderly. Stroke patients may present with a variety of physical, cognitive and psychosocial problems. Most stroke patients show signs of recovery over time. Types of stroke. Ischemic, obstruction to one of major cerebral arteries. Brainstem strokes are less common. Hemorrhage. -9% are caused by hemorrhage to the deep parts of the brain. Patients are usually hypertensive. Localizing signs and symptoms. Sudden numbness or weakness of face, arm or leg, especially on one side of the body. Sudden trouble walking, dizziness, loss of balance or coordination. Sudden confusion, trouble speaking or understanding. Sudden severe headache with no known cause. Sudden trouble seeing in one or both eyes. Mechanism of stroke. A stroke is a condition in which the brain cells suddenly die because of a lack of oxygen. This can be caused by an obstruction in the blood flow, or the rupture of an artery that feeds the brain. Mechanism of stroke: ischemic, hemorrhagic. Lack of blood flow to the brain caused by a clot or rupture of a blood vessel. Sudden brain damage. Ischemic. Most common. Caused by a clot. Embolic and thrombotic. Hemorrhagic. Bleeding around brain. Bleeding into brain. Risk factors. Over age 55. Male. A family history of stroke. High blood pressure. High cholesterol. Smoking cigarettes, diabetes. Obesity and overweight. Cardiovascular diseases. A previous stroke or transient ischemic attack, TIA. Birth control or other hormone therapy. Causes of stroke. Ischemic strokes are ultimately caused by a thrombus or embolus that blocks blood flow to the brain. Blood clots, thrombus clots, usually occur in areas of the arteries that have been damaged by atherosclerosis from a buildup of plaques. Embolus-type blood clots are often caused by atrial fibrillation, an irregular pattern of heartbeat that leads to blood clot formation and poor blood flow. Hemorrhage strokes can be caused by uncontrolled high blood pressure, a head injury, or aneurysms. High blood pressure is the most common cause of cerebral hemorrhage, as it causes small arteries inside the brain to burst. Aneurysms, abnormal blood-filled pouches that balloon out from weak spots in the wall of an artery, are the most common cause of subarachnoid hemorrhage. A less common form of hemorrhage stroke is when an arteriovenous malformation, AVM, ruptures. AVM is an abnormal tangle of thin-walled blood vessels that is present at birth.